Good morning, my name is Shaina. I'm going to be demonstrating or giving an oral presentation on the assessment of the eyes. So, the first thing you want to do is you want to gather your equipment: a Snellen chart, a handheld Snellen chart or near vision screener, a pen light, opaque card, and ophthalmoscope. First, then after that, you are going to explain the procedure to your patient. But before that, you want to introduce yourself and then explain the procedure, and then you want to perform hand hygiene. Also, tell the patient that you have done your hand hygiene. So the first thing you want to do is assess for far vision using the Snellen eye chart. You want to have the patient stand 20 feet from the chart and test each eye separately by having the patient cover one side of his eye, left or right, while being tested. Then you also want to know the smallest line of patient. The smallest line of the patient is able to read with no more than two mistakes. Then you want to have the patient differentiate patterns of color on color palettes or identify color bars on the Snellen eye chart. This is or to identify figure embedded in the Ishihara chart. This is just to see if the patient can see color or can differentiate what's on the chart. And then you want to assess for near vision. You want to have the patient hold pocket vision screener about 14 inches from the eye. The normal acuity is 14/14 with or without corrective lenses. You can also use a print size picture if patient is unable to read. Then for the peripheral vision, you want to assess ability to detect movement coming in from the periphery, inferior, superior, temporal, and nasal fields. You have the patient stand in front of the patient face to face about 1 to 1.5 feet apart. Then you want to ask the patient to fix gaze straight ahead and cover one eye. Then you want to bring a pen or wiggle your fingers in front of the periphery from four different fields: superior, inferior, temporal, and nasal. And then you want to have the patient say now once objects are seen. Then you want to measure the degree of peripheral vision using the patient's fixed gaze as a base. And these all come in different degrees. Like superior comes in 50 and etc. Then, for the extraocular muscles, you want to test for the corneal light reflex. You want to inspect the eyes for any parallel alignment. Shine the light directly in the patient's eyes, so you want to know the position of the light reflection off the cornea in each eye and look for the sparkle. And then, you want to do the cover and uncover test. Cover the patient's one eye and have the patient focus on an object afar. And then after that, you want to uncover the eye and note any drifting. So you go like this and have the patient see an object from afar and have him take off the hand or remove the hand and see if there's any drifting for the patient. And then for the cardinal fields of gaze test, you want to stand in front of the patient and instruct him to fix the gaze straight ahead and have the patient follow your finger or an object. You want to note patients to do so and note any nystagmus. Then for the external structure of the eye, you want to inspect the general appearance, the clarity, and the parallel alignment of the eye. And then you want to note any symmetry, distribution of eyelashes, and inversion or aversion. Then you want to inspect the eyelids for any colors, lesions, edema, lid bags, or any like symmetry of palpebral tissues, or any swellings or just anything. Then you want to inspect the eyebrows for the shape and evenness of the hair. And then you want to inspect the position of the eyeballs, alignment in sockets, protruding or sunken. Is it popping out or is it in? Is it normal? And then you want to inspect the lacrimal glands, which are located below the eyebrow, which is here. And then the nasolacrimal duct. You want to note the color, the edema, the excessive tearing or drainage of the lacrimal ducts. And then you want to examine the palpebral conjunctiva by gently pulling lower eyelids down. So you want to go like this. You want to examine the bulbar conjunctiva using a Q-tip and gently roll the eyelid up so that. You want to assess the clarity, the color, texture, moisture, lesions, and foreign bodies of conjunctiva. So, and then you want to inspect the sclera for color, moisture, and lesions or tears. And then the cornea and lens by shining a light on the cornea from an oblique. And then you want to know for any clarity, lesions, abrasions. And then you want to assess the corneal reflex testing. You want to take a wisp of cotton, rolled cotton, and gently touch the cornea. Or take a needle syringe filled with air over the cornea and note any blinking or tearing. So you just want to go like that. See if there's any like blinking or tearing. And then you want to assess the iris for the color and shape. So you want to check if the iris is either brown, blue, green, black, pink. Then you want to check if the color, you want to check the shape of it. And then you want to assess the pupil size, the equality, and test pupillary reaction to the light. So you have the patient look at the light. If the patient's pupil expands or goes small, the speed, the reaction time, and then after that you want to do your accommodation. You want to hold your finger for an object in front of the patient from a distance of 14 inches from the patient, and then you want to instruct the patient to focus on your finger. And then you want to note any convergence of eyes, so like this, and then you're like looking like that. And then you want to assess the anterior chamber. You want to have the patient look straight ahead as you shine a light from the side across the eye. And then after that, you want to note any clarity and shadowing from the iris. Then you want to gently palpate the globe of the eyeball below the eyebrow, and then you want to note firmness of the fingertips. Okay, so you want to know any consistency and tenderness, but do not palpate the eyeball with patients with eye trauma or known glaucoma. So now for the internal structure of the eye. You want to inspect the red reflex by using an ophthalmoscope. You want to stand 1 feet from the patient at 15-degree angle from the patient's line of vision. You want to place index finger on the lens wheel and turn wheel as needed to focus. You want to keep free hand on the patient's forehead to determine distance. Then you want to shine the light beam toward the client's pupil. And then note for any reflex. You can easily see the red reflex around the eye, the regular borders. Then you want to inspect the optic disc of the eye by using an ophthalmoscope. Focus on the pupil and moving very closely to the eye, so you just like that, using the ophthalmoscope. And then you want to rotate the diopter, sitting until the retinal structures are in shape or are in sharp focus. You want to observe for the observed disc for border, the shape, the color, the size, the physiological cup, the center of the disc, the nose size and color. And then you want to inspect the retinal vessels using the above technique, the same one, and you want to note for the size, the color, diameter, arteriovenous ratio, and arteriovenous crossings. And then you want to inspect the retinal background for color and presence of lesions. And then you want to inspect the fovea and macula, which is located temporarily opposite the optic disc. And then you want to note for color, lesions, and vessels. Finally, you want to inspect the anterior chamber for transparency. And that's how you assess for the eyes.